Welcome to CBC Saskatchewan's coverage of the 2026-2027 Saskatchewan Budget. I'm Adam Hunter, host of the morning edition, live in the Rotunda at the Saskatchewan Legislature. Thanks so much for joining us on CBC Saskatchewan. I'm joined by our provincial affairs reporter at CBC, Alexander Quon. Alex has been poring over pages and pages of budget documents, and we can now talk about what's in this year's budget. Alex, what stood out to you so far from the last few hours of learning what the government's planning financially for the next year?
It's going to be deficits for a while. Right now, we have been told it's going to be an $819 million deficit in this fiscal year. And of course, we also got the third quarter of updated financials from last year's budget. If you remember, that started out with a $12 million surplus. That has now grown to a $1.2 billion deficit. So it is a lot of kind of concerning financials because we've seen deficits, and now the government is also not predicting to get back in the black until at least 2030-31. So the next decade until the government's projecting a surplus. Far cry from what we saw last year when there was that tiny surplus projected, which didn't turn out to be the case within really weeks, I would say. Alex, what has been the reaction from the finance minister to some of the questions about that projected deficit well into the future? Well, the finance minister has really kind of made this as a budget that is about tough choices. It's a budget where they had to decide between possibly cutting services or raising taxes. And instead, as the title of the budget has kind of alluded to, they're choosing to protect Saskatchewan services. So they are making tough choices. The finance minister, Jim Ryder, has said it's not easy to do a budget right now with the kind of economic uncertainty. Falling commodity prices are a huge factor in this, and they're just wanting to try and keep things as realistic as possible, is how he phrased it to us.
And what's been the reaction of the opposition this afternoon?
Well, the NDP have had a very simple message. They say this is a bad news budget. They say that they also say they don't believe the numbers. They point to the 12 million surplus last year and how that quickly fell apart under scrutiny and has kind of played out into reality with these updated financials. So the NDP they're not happy. They don't believe the budget. They also say that this is not a budget that is going to make many people happy.
Alex, thank you.
You're welcome.
That's CBC's provincial affairs reporter Alexander Quon. Him and I will be bringing you coverage and reaction here live from the legislature over the next couple of hours as we talk to stakeholders, government, and opposition. We'll take a look at the projected financial overview. As Alex alluded to, over the next number of years, the government projecting deficits. As he mentioned, $819 million for this fiscal year, $608 for the next, $381 million, then $137, and finally projected surplus of $124 million next decade, 2030-31. Debt projection, combined government and crown debt at $43.5 billion. Government debt, excluding crown corporations, $26.8 billion. And that's taxpayer-supported debt, and the debt payment for the government for this year is over $1 billion as well. We're going to take a look at non-renewable resource forecast assumptions. This will have a big impact on the government. And we talked about the uncertainty in the Middle East, and that's something that Finance Minister alluded to earlier today. The projection for WTI oil at $59 a barrel, oil production 165 million barrels, potash price at $289 US per kiloton, and Canadian dollar at 73 cents US. Here's our revenue areas. If you add up this taxation, that is the majority of it, but you can see federal transfers there, just under 20% of all revenue for the government. Revenue projected at $21.4 billion. PST, almost 17% of all revenue for the government. We'll also look at the spending areas. No surprise here. Health at $8.4 billion, education $4.6 billion, social services just under $2 billion, ag at $1.7 billion, and interest payments and debt servicing at just under $1 billion at $500 million. We're going to take a look at those throughout the show today for you. And now we're going to throw it to Alex, who is with a guest. Alex, take it away.
Yeah, hi Adam. I'm here with Randy Golden, the president of SUMA. Randy, I guess right off the top, what are your thoughts about the budget?
Well, what we heard in this government's 19th budget, we are pleased to hear about the increase in the municipal revenue sharing. It has gone up to $392.4 million. We're pleased about that. We're pleased about the additional funding to SAMA, which will help our municipalities with the share that they have to contribute. What we didn't hear were some of the things that we still have concerns about that we've brought to the provincial government before. So some of the pressures on our urban municipalities to provide for infrastructure needs, to provide for the services that we have for our citizens and the citizens that live in all the municipalities around us, there's some concerns around those.
In terms of the municipal revenue sharing, obviously it went up, but did it go up enough to help some of the municipalities in this province?
It has gone up, but it has not gone up to cover all the increased costs that we're seeing in our municipalities. We know that the products are costing us more, the delivery is costing us more, and unfortunately that increase will not meet the additional costs that we have.
Can you maybe help people at home understand, when you say infrastructure for large municipalities, what does that look like for a municipality, and why is it a particular challenge for them?
So our urban municipalities are made up of the cities, the towns, the villages, the resort villages, and the northern municipalities. So they run from the very smallest village to the very largest city. And what we see is the same type of cost needs, whether it's in a rink, whether it's in putting infrastructure in the ground. Everyone has to turn their taps on and get clean water. Everyone has to flush their toilets. And that has to go away somewhere. And there's costs for all of that. And those are increasing. The needs are increasing and the costs are increasing.
For the people at home, maybe highlight, if you could, some of the things that you do like about this budget. You mentioned obviously the increase to the revenue sharing, but are there anything else that you see in this budget that you're happy about?
Well, we've seen some of the revenue sharing that's coming to us. We've seen some of the things around the SAMA budget, but the things that we have not seen are what concern us. So we're very pleased about that because that will mean more revenue. But we would like to see more ways to get revenue for our urban municipalities so that they can generate their own source revenues besides property tax and fees, which cover the costs of operating facilities. And we know that if our urban municipalities are successful, so is the whole province. And it was good to hear our Premier and our Finance Minister both talk about the new sources of things coming into our province that are coming in to bring employment in. But that employment is going to need places to live. They're going to need places to recreate. And those things happen in our urban municipalities.
I wanted to get your thoughts. It's obviously a deficit budget, and they're looking at deficits for at least the near future.
Yeah.
But they say that this was done in order to preserve services. What are your thoughts on making sure that taxes aren't going up, but preserving services, even if it does mean that we're running a deficit?
Yeah. Well, it's very interesting because municipal governments are the only part of government that cannot run deficits. We have to have balanced budgets. We're forced to do that through legislation, and yet our other governments can do that. And I would like to know, how do they cover that? Who picks up the interest? Well, we know there's only one taxpayer, so that concerns us.
Okay. Randy, thank you very much.
Thank you.
Thank you. Adam, I'll throw it back to you.
Thanks so much, Alex. I'm here with Murray Mandrick, who's a part of our political panel every Friday on the morning edition. Murray, you've been looking at the budget. What stands out to you? What's your big takeaway?
When $819 million in deficit is your good news, you have a bit of a problem. Now, it's good news in the sense that we now know what it is, and we didn't last year, this problem, and I'll get into that very quickly in a moment. We started last year with $12 million surplus that turned into $1.2 billion deficits, and that's just a bloody mess. You can't really structure anything in terms of figuring out how to deal with the finances, how to deal with the obvious spending problem that you have if that is your parameters upon which to work. So there was nothing to work with last year in terms of understanding the budget. It's sad to say that $819 million at the start of budget is necessarily a good thing, but at least we kind of know where we are at. There's other good things about this budget, by the way. I think the best thing is not even related to the budget. The line that the government has been using for the past couple days, that we have 60 projects worth $60 billion worth of stuff that's going on in this province, is actually kind of our salvation right now, Adam, because that is propelling Saskatchewan economically forward and propelling the budget forward in some ways.
These are major capital projects that the government's invested in.
Yeah, and here's where that's a great thing. Where we are having a little bit more of a revenue success in this budget is another $260 million worth of PST. Well, that's not coming from population growth. That's not really coming from a massive increase in labor and jobs. We know the problem with immigration and the fair other problems in terms of Saskatchewan right now, but it is coming from projects like the Jansen Mine, the KNS, and everything else that's really good news for this province. And it's that kind of thing that's going to be the salvation for this province to move forward. Maybe one of the reasons we might not have a credit downgrade, that's a distinct possibility right across this country right now, because everybody's coming in with a horrific budget right now. But in Saskatchewan, they're talking us being, the top 1, 2, or 3 in net GDP to debt ratio, to all the critical factors that weigh into whether we're being judged by the banks in New York as being solvent or not, and these are good things. But right now, we're still not dealing with the actual problem that we have, which is structural problems in terms of taxation and the amount we spend. If you look at what we're spending right now, it's going up another $1 billion, and our revenue isn't. And that's problematic, and we need to at some point or the other get a handle on that. Now, they chose as a theme of this budget protecting Saskatchewan, which is a good thing. There's a nice little picture of these cute little farm kids, cute little gingers running around in the field and looking great. And it's a good thing to signal. But how are you protecting them when you're adding another $200 million annually to the financial charges, basically the interest on your credit card that we have to pay first before we pay anything else? And by the way, that whole issue is now exceeding protection of Saskatchewan people in terms of fire, police, and everything. Is the third biggest line item behind social services, agriculture, and I guess education. Fourth biggest line item, which is just fantastic. Fantastical in the sense that all of a sudden, right now, we're spending more on these particular areas than we are on things that are going to actually help people. That's a big deal. We're adding this huge amount every year. We've added another $2 billion to the public debt. And that's highly problematic. So that's a structural problem that we're starting out with. At least we know what it is this year, but that doesn't necessarily make it brilliant news.
Murray, thanks. We'll check in with Murray in a little bit. Murray Madrick, a political columnist, and our part of our panel every Friday on the morning edition. Alexander Quon is the other half of that panel, and he's with the guest right now. Alex.
Thanks, Adam. Yeah, I'm here with Gage Hobrick with the Canadian Taxpayers Federation. Gage, what's your reaction to this budget?
Well, it's a terrible budget for taxpayers. Right now, taxpayers are on the hook for more than $1 billion in debt interest costs every year. That's money that can't go to essential services, can't go to tax cuts. It's just flushed down the drain because of the government's poor financial decisions. We're seeing more of the government's poor financial decisions in this budget. The government's spending more on essentially everything across the board. They spent no effort in trying to find savings for taxpayers to get that huge deficit number down, to stop adding to the debt so much. And we've seen that as a pattern from this government, and it's costing taxpayers more every year. And it's going to continue to cost them this year.
The province says their goal with this budget was to protect services while ensuring that they're not raising taxes or cutting services. I guess, what are your thoughts on that?
Well, I think essentially it's an excuse, right? I've been here for a couple of years now. Every single year for the past couple, the government has added more to the debt. They've spent more than the year previous, and they've saddled taxpayers with more debt interest payments. I think what they're doing this year is using international events as a clever excuse to hide their proclivity for overspending, but it's overspending just the same.
The province is also saying that they won't get back into the black until at least 2030-31. What do you make of that they're going to be planning for deficits for at least until the end of the decade?
Well, it's unfortunate because it's just kicking that debt can down the road, right? We've seen since the Premier's came into office, more than a doubling of the provincial debt. That's already awful. Now he's adding billions of dollars more on top this year and well into the future. Eventually the government has to deal with this overspending problem, or it has to hike taxes on Saskatchewanians. So the government needs to control spending, find a way to actually get the spending down, not simply kick this problem further into the future where it's going to become much worse.
I guess what would you want to see the province do to address the problems that you highlighted?
Yeah, there's two main things that are super important. The number one is find anywhere, any way to cut spending, right? The government is spending $1.2 billion more this year than last year, spending more in almost every single government department. If the government was serious about looking for savings to try to find some ways for taxpayers, there would be at least a couple things in there that was reducing spending overall. We didn't see that. And then the second biggest thing, as we see every year, is the government needs to stick to its budget. You know, we stand here on budget day every year, the government says they're going to spend X billions of dollars. We come back in a couple months and they say, oh, we've spent billions more. So the government needs to stick to what it's telling taxpayers it's going to spend on budget day and not blow it in the future.
You did mention the kind of deficits that they've run and the reality of what happens after they, a full year goes around. So they just tabled their third quarter estimates for last year's budget. They are now running a $1.2 billion deficit. What are your thoughts?
Well, that's a great example of the problem, right? Me and you were here last year when the government said that was going to be a $12 million surplus. Now it's a $1.2 billion deficit. Those aren't even in the same realm of the same numbers. And it shows that the government's kind of not being fully transparent with taxpayers when it projects how much it's going to spend every year. So the government needs to actually stick to its spending and be more transparent about what it's actually going to spend at the end of the year and how much it's going to cost taxpayers.
I wanted to also get your thoughts on the government has said that they are going to be looking to reduce by 3% the provincial workforce, essentially through executive government and at the Crowns. They're going to be doing this mostly through attrition. They say that is going to help save them some money. What are your thoughts on that?
Well, it's good to see the government do anything to try and find some sort of savings, but obviously it's not enough, right? The net spending is still going to be more than $1.2 billion compared to last year, so whatever they're doing is clearly not enough to try and stem the overflow of spending that the overall government is doing.
Awesome. Gage, thank you very much for taking a few minutes of your day with us.
Yeah, thank you.
Thank you. Adam, I will throw it back to you. Thanks.
Thanks, Alex. Adam Hunter here in the Rotunda, where you have live coverage from the 2026-2027 Saskatchewan government budget. I'm here with Sean Davidson, the president of the Saskatchewan School Boards Association. And Sean, what's your big takeaway from this year's budget?
You know, for the most part, it's pretty much what we expected. So on the operating side, we saw the government invest in the specialized support programming as they committed to do in the initial throne speech, that they would be adding 50 additional programs each year throughout this mandate. We see them honor that promise today, and we're very pleased about that. These programs have generally been quite successful in providing some additional supports to students across school divisions, so we're glad that they've honored that commitment. On the rest of the operating side, we have some concerns as to whether this will cover all of our inflationary and enrollment growth pressures. It will depend a little bit where the final enrollment numbers come in this fall. That the growth has slowed a bit in the province, so we're not seeing quite as much pressure there as we have in years past, but we're still certainly seeing some pressure. Some of our costs are escalating very rapidly in areas like transportation. You know, we've seen the price of school buses roughly double in the last 5 years. Parts are becoming dramatically more expensive. Seeing a real increase in fuel prices right now, which has some concern for school divisions going forward. Have to remember, this is an extremely large province with a very spread out population, far more than pretty much any other jurisdiction. So transportation is a huge factor for school divisions here. So we'll be watching that. Probably the most disappointing thing about the budget, though, is a lack of investment in preventative maintenance and renewal of our schools. So this year, the preventative maintenance budget is $65 million, which is exactly what it was last year. For a long time, we've been calling for that preventative maintenance budget to be at least 1% of the insured asset value of our schools, which is somewhere around $15 billion now. So we're far short of that 1% number. A number of our facilities are aging. I mean, let's face facts, most of the schools in this province are older than I am, and I got a lot of gray hair. So it's somewhat concerning that this is going to continue to put challenges on school divisions to adequately maintain those facilities. We know they can last a really long time if we have the resources to take care of them. And we've got a number of old castle schools in the province that are 100 years old and in great shape. But this kind of preventative maintenance budget is not going to allow that to continue. And that's probably our biggest concern, because we've certainly seen a huge amount of increase and appreciation of costs in construction. And so maintenance is no exception. You go to put in some HVAC work in a school or what have you, it's far more expensive now than it was even 5 years ago. So that's something that we had told the government we would be watching, and we're disappointed that they didn't invest at least something in that area to get us closer to that 1%.
We hear a lot from the government about building new schools, and school divisions and communities want new schools in certain areas. There is a commitment to that in this budget, as there is every year. What's the balance between building a new school and keeping a school that is in decent or good shape up and running, as you said? How do you see that balance?
Well, we do see some major renovations in some smaller communities in this budget. We certainly applaud that. On the capital side, I think we have some concerns that there wasn't further large capital investment in our fastest growing communities. Warm and Martinsville, of course, was announced. That's an important one. Those are very rapidly growing communities there. So we're certainly happy to see that. But in some of our other fastest growing communities, we didn't see any announcements today. So we have some concern there as to the capacity of school divisions to, provide services within the space that they currently have. When we have rapidly growing populations in communities like Saskatoon, it's challenging when we don't have more space to put all those little people. So that's something that we have some concern with. I think that we probably expected to see a little bit more on the major capital side this year, but like I said, we do see the three projects, and we're happy for that. There's always a balance between building new schools and fixing up old ones, and it really depends on the condition of the facility and the capacity within the funding of the board to maintain some of those older facilities. As I mentioned earlier, we have schools in, say, my home board in Moose Jaw that are 100 years old, that are in fantastic condition, because we've had the ability to maintain them, going back to the days of local taxation, where a lot of those major renovations in those old schools were completed, prior to amalgamation and that sort of thing. So it's always a balance between renovations, maintenance, and building new. School divisions are the best people to comment on their own individual circumstances, because of course it varies across the province. But we do know there's a number of, for example, the area where I come from in southwestern Saskatchewan, we don't have a lot of delusions that we're going to be getting a lot of new schools down there with a relatively small population. So we need to maintain the facilities we have, and we're happy to do so, just we need the funding to make sure we can make it happen.
Sean, thanks for your time. Appreciate it.
You bet. Thank you.
That's Sean Davidson, President of the Saskatchewan School Boards Association, reacting to this year's provincial budget. We're bringing you reaction live from the Rotunda here at the Saskatchewan Legislature. The Finance Minister announcing the budget details just a little while ago. Alexander Quon has been covering the budget for us. He's our provincial affairs reporter, and he is standing by with a guest. Alex.
Thanks, Adam. Yeah, we're going to keep the focus on education right now. I'm here with Matt Love, the NDP's education critic. Matt, what are your thoughts on this budget?
We hear the same thing every year on budget day about record funding, but families and students and teachers, they know the truth. This is another Sask Party budget that's going to see cuts in the classroom. This is a budget that has nothing new in terms of the supports that our students and teachers need, and there's actually a massive cut to school capital. And it's a cut to school capital at a time when we have hundreds of schools that are crumbling in this province by this government's own data. There's hundreds of schools falling apart, as well as dozens of schools that are bursting at the seams. So to see a cut to school capital, I think is not going to serve our students and teachers well. And ultimately, I think it's a bad news budget for education in this province.
There was a lot of discussion from the finance minister about making tough choices, and capital budget appears to be one of those tough choices that they've made. You highlighted that obviously schools are going to be getting less money this time around. What other issues do you see in education that weren't addressed in this budget?
We still have classrooms that are crowded. And I think that this is a budget where we're going to see boards having to make cuts and, again, making really difficult choices in the coming weeks and months. We have growing complexity in our classrooms. The needs of students coming in are not being matched with investment from the provincial government. And that, of course, leads to a whole slew of problems in the classroom. So I think that there's all sorts of things that this government continues to show they're really out of touch with the needs in our classrooms today.
They also highlighted three new plans, at least, for schools throughout the province, as well as work on planning additional schools. I guess you highlighted that there is going to be there's issues with overcrowding, there's issues with class size. Is the province doing enough to build schools, to build the capacity so that we don't have overcrowding as an issue?
Absolutely not. No, we've got schools in Saskatoon, Regina, and outside our major centers that are bursting at the seams. We've got entire communities built out and no school anywhere in sight. This is a government that hasn't planned for growth, and ultimately they're not listening. They're not listening to municipalities, they're not listening to school divisions, they're not listening to families that are sending their kids out of community just to find a school where they can fit. So again, I think it's a bad news budget for education, and I think it really reflects the Sask Party government that has lost touch with what's happening in our schools.
Last fall, the province introduced the Build Schools Faster Act. I want to get your thoughts on, has that worked? Is it going to work? What are your thoughts on it?
I have a lot of concerns about that legislation, if it's going to actually do anything to change the pace at which schools are being built. But I'll say it's great to see the government admit the massive failure that they've created with their own changes and their own policies that have led to this incredible delay in getting new schools built. It is a massive problem in this province. Unfortunately, I'm not sure yet that legislation is going to do anything to solve the problem that they created.
All right, Matt, thank you very much for your time. We really
Thanks so
appreciate
much.
it.
Yeah.
Awesome. Thank you. Adam, that was Matt Love with the NDP. I'll throw it back to you.
Thanks, Alex. You hear education critic Matt Love of the opposition with Alex. They're reacting to the provincial budget. Any more reaction now from Jim Farney? And Jim, what are your thoughts looking at what you've seen today?
I mean, I think everybody's going to grab onto that top line deficit number, and that matters a lot because it's both this year borrowing and increasing debt as a part of GDP. So there's a big story there. I think the other bits, I found it really interesting how the government kind of spread investment in penny packets across things, leaning more towards capital than programming. So there are new hospital beds and treatment facilities and highways and all of the stuff, but they've deliberately said we're going to reduce headcount in the public service. So I'm curious to see as the year rolls out what that looks like. And the kind of the top line framing of we're protecting Saskatchewan, we're trying to not make any big decisions is what I read into it. So we're going to continue both with tax cuts, these little minor investments, and we're going to borrow to bridge the gap between the two things.
Does it surprise you to see the government projecting deficits into the near future?
I mean, this has become a habit for them. I think what changed this year was it's not just deficits, which they do a pretty good balance of capital borrowing and operational borrowing. It's that we're going to start significantly increasing our debt servicing costs and our debt to GDP ratio. And unless they manage to put the brakes on it in the next couple of years, we'll be starting to get into the high teens on that debt to GDP percentage.
It seems, in my read, in some ways, is that all the provinces are doing this. The federal government's doing it, and so we're not going to make a rash decision, cutting programs or raising taxes because our friends and neighbors aren't doing that either. Do you see that to be the case?
Yeah, I mean, we're all facing really strong headwinds. We've got the economic uncertainty, we've got population decline in Canada, not Saskatchewan. And so your revenue sources are shrinking. At the same time, you're running more expensive healthcare, more expensive education. But you do make the policy choice about are you raising taxes or lowering taxes. We chose to lower taxes.
And what are you watching for now? Because I think everyone's taking a look at what's happening in the Middle East because that's going to affect things like the oil price, commodities. Also, we were just talking to the School Boards Association, the cost of gas for school buses or parts, things like that they're worried about heating the schools. What are you watching for when it comes to that conflict and how it could affect the provincial finances?
Yeah, so exactly all of that. It's going to make things more expensive on the expense side. It could be like what at the start of the Ukraine war meant for Saskatchewan, where we saw revenues increase because oil went up, potash went up. So there's some possibilities there. I worry a little bit about what it's going to mean for agriculture as diesel and fertilizer get more expensive. But I think it's almost exactly like what we were talking about last year with American tariffs. It's very hard to predict 3 weeks into these things the long-term effect, and so they've made the decision to just kind of continue with the status quo forecasts because they really don't know in 8 months what we'll be looking at.
How do you look at budget day, seeing as last year was like such a wild, really miscalculation of what they expected, seeing a surplus of $12 million, and then we find a $1.2 billion deficit. How should we frame budget day, knowing that that kind of thing can happen?
I think of budget day as kind of your best set of expectations, and we've been used to kind of plus or minus 5%. Stuff always happens, right? There's a bad wildfire season or a drought. I think what we're dealing with now as a very export-exposed province is more like a plus or minus 10% margin of error. And it would be a little unfair to expect perfect accuracy a year out. So it becomes important about kind of updates. There's not big contingency funds built into this. So kind of that set of things, and also paying more attention to the estimates process, to kind of the detailed accounting of what happened last year. There was some late in the third quarter spending through cabinet orders that, is just worth paying attention to, even if 5 years ago we wouldn't have used it so much.
Jim, appreciate your time. Thank you.
Thank you, Adam.
That's Jim Farney with the Johnson Shoyama School of Public Policy. And we're going to go to Alex Quon, who's with a guest reacting to this year's budget.
Hi, Adam. I'm here with Mira Conway, the NDP's critic on health. Mira, what are your thoughts on this budget?
Frankly, I'm a little stunned. I think that whether you're a provider or a patient of healthcare, you can feel that we're at a crossroads. People are waiting longer. We have unprecedented capacity issues, service disruptions. We have some of the worst access to primary care in Canada. What I would have liked to see is a fundamental change in how this government approaches healthcare. We don't see that. We see them announcing this patient first plan that was first announced in 2009, then 2012, then 2015. We've been very clear. We think those are recycled ideas with a new cover. One of the changes we see is a recognition of the value of nurse practitioners. Well, great. I mean, many jurisdictions have been doing that for years. But today in Saskatchewan, on the SHA website, we have over 100 nurse practitioner positions that have gone unfilled. Over 24 of them are stale from last year. So they can, announce as many positions as they want, but if they're not going to do the work in the system, making sure that frontline healthcare providers are recruited and retained, shifting away from this waste and mismanagement. I think of the AIMS project. We've still not seen any accountability on that. The hundreds of millions we're spending on overtime or travel nurses, which chip away at the morale of this local fleet of nurses we have. We don't see any change in that, and if we don't see a shift, we're just going to see more of the same, which is a flatlining healthcare system, spending more, getting less, and that's really what we've seen from this government for years on healthcare. And I'm really disappointed that we haven't seen a fundamental shift in anything on healthcare.
I mean, the government has said this Patients First program, their Patients First plan, it is obviously driven by nurse practitioners, but it's going to be expanding the role and scope of other healthcare workers. I wanted to get your thoughts on that. Is that a solution out of the kind of issues we're seeing in the health system right now?
Well, if they actually do it, the first time they talked about expanding the scope of providers was back in 2009, and they've talked about it in every patient first plan since. So I think people are rightly asking, you didn't keep your healthcare promises from back then. What's different this time? So I'm really concerned. We see a 0.3% increase in spending when you compare this budget to actuals from last year, projected actuals. I don't know. We're getting an increase of federal health transfers of $122 million, and yet this government is budgeting only to increase health spending by $20 million. And I want to be clear, if we don't fundamentally shift how we're allocating those resources away from all this waste and mismanagement, women being sent out of province to for-profit companies that donate to the Sask Party for 10 times the cost, we're not going to get ahead in healthcare. We're not going to get out of this mess that we're in.
The province has also highlighted that they are concerned about patient safety. They're concerned about security. They are going to be initiating a kind of a security review that's already underway, but they're also going to be expanding security teams at hospitals in Prince Albert, in Saskatoon, in Regina. Do you think that's going to be enough to make people feel safer at the province's hospitals?
So I think we need to address that in sort of two ways. The first is that immediate acute risk. And we were joined by security personnel here in the legislature. We asked the Premier to meet with them actually because they were talking about good paying jobs, good training, public public jobs, not contracting this out to a private security firm. The Premier wouldn't even meet with them. We need well-trained, well-paid people, because that's a tough job, and we need good people doing that job. We also have to, though, address the root causes. Emergency rooms are one of the last places that people can go. So all of this government's failures on social issues, be it mental health and addiction, be it their wrong-headed changes to social assistance, which have driven up homelessness, like removing the direct pay to rent, that is all spilling into our emergency rooms. So until we see this government address those underlying causes, we're not going to see things improve.
Now, before they came to us, we were talking a little bit about your guests today for the budget. Can you share a little bit about why you brought them here today?
Yeah, so I'm joined by many frontline healthcare workers today. I haven't had a chance to speak with them because of course the budget was embargoed till a few minutes ago. But I know they're going to be disappointed, and they're going to be disappointed because we see nothing in this budget to resolve these healthcare contracts that, of course, are in bargaining right now. People who haven't seen a raise in going on 4 years, people who haven't seen a contract in 4 years, who are upset, rightly so, because we see this SHA executives get a $300,000 increase in pay. Pay raises across the board for them. Meanwhile, frontline healthcare workers who are really holding up our system are seeing nothing, and I think they take that as a lack of respect. But more importantly, they can't make ends meet. We have folks stopping in at the food bank on the way home. That's not acceptable. These should be good jobs. We should be valuing the people that hold up our system. We should be building a healthcare system that is worthy of the people that hold it up each and every day.
Your leader, Carla Beck, has called this a bad news budget. I kind of want to flip it around. Is there anything in the addressing health in this budget that you actually like?
Look, I like the change of language around that recognition of nurse practitioners. I've been very clear from day one that we need to be doing that. This team-based care approach is definitely going to make part of our big, bold solutions in healthcare that we're going to be coming forward in the months ahead. But again, you can announce as many positions as you want, and if we have hundreds of positions that are unfilled and you have no strategy to educate, to recruit, and to retain these personnel, we're not going to see this move forward. And again, I would just look at the Sask Party's record. We see the patient first plans from 2009, 2012, 2015. Those are broken healthcare promises on every single page of those plans. So what's different this time? I'll be watching that very closely.
Mira, you also rose in question period before the budget. You raised issues around hiring from Americans to come work in the healthcare system. Could you maybe explain what you were trying to raise and why you think that's an issue? Yeah,
absolutely. So we put in a written question and we got an answer today. And the written question was, they announced as part of their big, bold recruitment plan that they would be trying to recruit American doctors. And we've seen, for example, in BC, over 400 healthcare workers have been recruited from the United States and are working in BC today. We asked the question, how many physicians have you recruited from the United States? And they answered us very clearly, three physicians. And we know that last year in Saskatchewan we lost doctors. We have fewer doctors working in Saskatchewan now than last year. And we know that many of our existing physicians are due to retire any day. So if we think we have a crisis in primary care now, it's only going to get worse.
Awesome. Mira, thank you very much for talking with us today.
Thank you.
Thank you. That was Mira Conway, the NDP's health critic. As you can see, the chamber has now let out Adam, which means it's going to get very busy. It's already getting very, very loud. I will throw it back to you, though. I'll find another guest that we can talk to.
Thanks, Alex. As you can see here from the overhead view, as Alex mentioned, the chamber's let out. And if you haven't been to Budget Day, I'll give you a bit of the behind the scenes. There are many big rooms here at the legislature, including the gallery you see there in the middle of the rotunda. Down on the first two floors, you can watch on TV. There's other overflow rooms that you can see guests in. They'll seat and watch that because, of course, the House doesn't seat as many guests as there are right now, and you can hear it getting louder and louder in here. So people streaming out on Budget Day. We're going to take a look at the big numbers that we want to highlight for you here for the 2026-27 budget. Again, a projected deficit of $819 million, revenue at $21.4 billion. This is a projection, of course. This is up from last year. but also up from last year is how much the government is spending. $1.2 billion more for an expense line of $22.2 billion, a 5% increase from last year's budget. We're going to take a look at the financial overview. This is another one of the storylines that's emerging. We heard from Jim Farney from Johnson Shoyama School of Public Policy and Murray Magic, our panelists on the political panel on CBC Radio, talk about this financial overview over the next number of years, 27-28 to 29-30 deficit. So 4 straight years of projected deficits, including this fiscal year, finally getting into a surplus projection, not until the next decade of 2030-31 at $124 million surplus. A reminder for people, last year at this time, the government was projecting a $12 million surplus. That turned into a $1.2 billion deficit. We'll take a look now at some more numbers for you from this year's budget. This is the debt projection. Combined government and Crown debt at $43.5 billion. Government debt, excluding Crown corporations, at $26.8 billion. That's taxpayer-supported debt. And something to highlight here is the debt financing for the government at $1.2 billion. That means our credit card payment, what we're paying this year just to service that debt, over $1 billion. We're going to take a look at non-renewable resource forecast assumptions. Something to highlight here is the WTI oil price. It's projected for this year to be $59 a barrel, just under $60 a barrel right now. That WTI oil price, if you were to Google it, is much higher than that. Oil production and potash price both on there, those assumptions, and then the Canadian dollar at 73 cents US. We'll look at revenue areas for the government here on that $21.4 billion. If you add up personal income taxes, other taxation, provincial sales tax, that is, of course, the majority of what the government is bringing in revenue. The other big chunk, almost 20% from the federal government in transfers to make up that $21.4 billion. We'll look at spending now. Of course, no surprise, health always the most expensive line item in the budget, $8.4 billion. Education at $3.6. Social services just under $2 billion. Ag at $1.7 billion. And then interest payments and debt servicing at $1.2 billion. We are live from the Rotunda. This is CBC Saskatchewan's coverage of the 2026-27 budget. I'm Adam Hunter, host of the morning edition. Alongside me is provincial affairs reporter for CBC Saskatchewan, Alexander Quon, who's been covering the budget all day long. And Alex is standing by with a guest. Alex.
Thanks, Adam. Yeah, I'm here with Bashir Jallow. Bashir, you represent healthcare workers as part of CUPE. What are your thoughts on this budget?
I think, so we just got the budget. We are still going through it. But quite frankly, I feel like this is another missed opportunity. And to be frank with you, it's very disappointing. Because I did not see the budget addressing the root cause of what we are facing in our healthcare today, which is the chronic short staffing, and then the burned out of staff, and also the lack of acknowledgement for healthcare workers. There's nothing. We did see some investment towards infrastructural development, like the hospitals and urgent care centers, but we have seen this before. We have heard this before. Infrastructural spending are great, but who is going to be there to run these facilities? We have urgent care facilities, hospitals facilities today, and we do not have the staff. People are leaving this province. I don't know how many times we have seen it. And so we did not see anything that will address the recruitment and retention crisis that we face. And if there has to be any commitment to fix that, it has to start with respect for healthcare workers. And that is respect at the bargaining table. Healthcare workers have gone for 4 years in this province without a single raise. All we are doing is the government and their bargaining agent are slow walking our process. They keep throwing grenades in our to slow us down. This is not good. If we want to fix the healthcare system, we have to look at the people who are there doing this job.
I guess, what does it do for morale when the workers that you represent aren't getting raises for 4 years? What does it do to morale? What does it do to recruitment?
It is painful. We have come here every year. We talk to the minister. We have met with the ministers on several occasions. We've met with all the MPs in this, the parliamentarian in the province. The morale is so low in the hospitals, in the long-term care facilities, because they feel that we are not being heard. We are not being consulted. The government announced the patient first healthcare plan. We heard it from the media. We are not consulted. And how are you going to put patients first if we don't invest in the workforce. There has to be an investment in the workforce.
Yeah, you did mention the Patients First plan that the province unveiled a few weeks ago. You mentioned obviously you weren't consulted. Is there anything in there that you are happy to see?
Well, I don't know. First of all, this is not something new for healthcare workers. It is probably something new for the government. This is what we live and breathe every day. We get up every day to go to work because of these patients. Even though we are not getting pay, we are not getting any raise, the working condition is not good. We are there for these patients. So therefore, we felt that we should have been consulted. We don't see anything. There's no funding. I listened through the budget. There's nothing I saw in this budget that is going to go try to do that. And for you to be able to do that, you have to respect healthcare workers, and that starts with working with healthcare workers at the bargaining table.
You mentioned meeting with the health minister multiple times. You mentioned having discussions and feeling like you're being slow-walked on new contracts. I guess, what do you think the health minister thinks of you and your members and what you are wanting?
I don't think the health ministers, quite frankly, I don't think we feel acknowledged by the health ministers, because every time we talk to them, even when we are in the office talking to us, he's only referring the investment on healthcare, referring to doctors. We feel that it's very painful, it's very disrespectful. They did talk about expansion in diagnosis services. Where are you going to get the people? We do not have the people. You can buy all this equipment, you do not. There is an expansion of CT in the Pascal Hospital. We heard about PET CT being Regina. Who is going to run it? We do not have the current capacity. You have to be able to retain the current healthcare workers if you want to increase capacity. But all we are thinking about is expansion of facilities and then equipment.
If the new facilities or the expansion of these facilities don't have workers, they don't have the people to staff, what, I guess, do you see as a potential consequence for that?
It's just a political stunt. That's what I think. We are building hospitals, it is there for the public. It's a very good media for the press, for the people, for the public, for the voters to see. You go to Radville, you go to Sherbrooke, you go to many long-term facilities in this town. They have the equipment, but they don't have the people to run it. Go to the Radville, they have a state-of-the-art healthcare centers. You go to Sherbrooke, they have the state-of-the-art healthcare services. You go to North Battleford, they have the state-of-the-art medical facility, but you do not have people to run it. We need people to run these facilities. And that is where I think the discussion is being missed. There is no emphasis on what we're going to do to keep the current healthcare workers we have. And that starts with bargaining table. You have to respect people and work with them, not take away things from them.
Awesome. Bashir, thank you very much for speaking with us. Thank you. That was Bashir Jallow with QP, representing healthcare workers across the province. As you can tell, it's only getting busier in here. Adam, I'll throw it back to you.
Alex, I'm here with Vince Bruni-Bossio, the president of the University of Saskatchewan. What's your reaction to the budget and how it affects your staff and students?
Well, at a time when things are changing and there's a lot of uncertainty in the world, we're really grateful for the multi-year funding agreement because it gives us stability, predictability, allows us to plan forward for the next 4 years. And that's really important to us as we're trying to face change. So I would say we're very happy with, and very grateful.
With what's happening at the University of Saskatchewan, you're looking always to grow with your research department. How does that predictable funding help with what the University of Saskatchewan needs right now?
Well, when you think about costs, tuition, and the services we're trying to provide our students, and our research costs, it allows us to plan forward and not be, facing that reaction that's going up and down. We can sort of understand where we're going to be and what the costs are going to be as we go forward.
What about how it affects students with discussions around tuition increases and things like that?
Well, first of all, for students, this is great news because any kind of infrastructure, any kind of service or programming that we're trying to build takes more than 1 year to build. So we need that time to provide those services for those students. And even that includes all our services. So for students, this allows us a lot more of an ability to plan for them.
So in some years, we've talked to leaders at universities in this province and the colleges where the money hasn't increased and there maybe hasn't been an agreement in place. The agreement was expiring. Is this something that's just a positive for you in your school right now?
You mean, if I've understood the question correctly, you mean at times before when we haven't had increases? Yeah, so there's a 3% increase over each year over 4 years. So that allows us, the opportunity to think about growth in a measured way, in a practical way, in a targeted way. And it allows us, ensures that we're not going to be thinking about weathering a storm that might not allow us to grow. So from our perspective, 3% growth over each year for the next 4 years is great from our ability to sort of plan for growth in each college.
Vince, appreciate your time. Thanks so much.
Thank you.
That's Vince Bruni-Bossio, the president of the University of Saskatchewan, reacting to this year's budget. As you heard there, 3% increase over the next number of years in a predictable funding agreement for the post-secondary institutions in the province. Alexander Quon as a guest now. Alex.
Thank you, Adam. I'm here with Peter Gillimer with the Regina Anti-Poverty Ministry. Peter, what are your thoughts on this budget?
Well, I guess first of all, coming into it, I'm looking at the context that we're in right now, which is we have the highest child poverty rate of all the provinces, the second highest poverty rate, and we have the greatest depth of poverty for low-income families across the country. We're the deepest poverty, and so when we're looking at affordability measures, when we're looking at the people that we're working with, affordability means not even being able to meet the most basic necessities of life: housing, food, utilities. Looking at what was announced today, at first glance, the $1,000 for utility arrears sounded like a positive, but the reality is that it's a recoverable benefit, so it'll be clawed back from people's benefits over time. The other reality is that when the CIS program came in 2019, the first thing that we noticed was that for the first time there was a program that wasn't covering the cost of utilities, period. It was wrapping them into an inadequate shelter allowance that wasn't even enough to cover people's rent. So we knew that there was going to be huge utility arrears built up for people on the program, and certainly this isn't going to mitigate that. We really need to go back to covering the actual cost of utilities for people on all provincial income security programs. The other concern that we have is that they're completely shutting down the rental supplement program. This was cut in 2018, but it was grandparented for those people who were on the program at the time, and many people have counted on that program to keep a roof over their head, but it's now going to be gone as of August of this year. So what we see is that with all the difficulty, with all the difficulties that we're seeing in regard to housing coverage, rental coverage, this does nothing to mitigate, and things are only going to get worse.
Peter, the government has said they are going to be raising CIS and SED rates by 2%. What are your thoughts on that?
Well, that's a very small rate. When we're looking at how low the rates are to begin with, 2%, we're looking at tens of dollars. We're not looking at significant increases. And the one thing that we have to remember with both programs is how inadequate CIS was when the program came in, but also with SED, it went 8 years without any benefit increase, and it's only in recent years that it's done some catch-up in terms of cost of living. But people on both of these programs, as I said, Saskatchewan has the deepest rates of poverty, meaning that low-income households are falling further below the poverty line than anywhere else in the country, and this does nothing to mitigate that.
You highlighted that this is going to be a challenge for people who are reliant on CIS and SED and other social services programs. I guess my question to you is, if this isn't doing enough, what will happen to people who are reliant on those programs? Well,
certainly we're going to continue to see a growth of people who are unhoused if we don't have the adequate social safety net that's in place. The utility question, it's been a massive issue for our office in recent years. The provincial auditor identified a couple years ago that there were 5,200 households on the CIS program that were dealing with significant arrears. We're also seeing significant utility arrears on the SED side as well now. So it's very difficult to gain and maintain housing if you can't maintain your utilities.
You and I have talked at these budgets over the last few years. We've always looked at these budgets. You've not necessarily come away thinking that this is going to help people that you help every day. Are you frustrated that the province's approach to this?
Yeah, well, and it is really showing up in the numbers. When you're looking at the highest child poverty rate of all the provinces, looking at the second highest poverty rate across the board, and the greatest depth of poverty in the nation. Obviously, what's being attempted is not working. And part of the irony for us is it was 10 years ago that the province brought in a poverty reduction strategy. And over the course of that decade, we've seen nothing but further austerity and more cuts. We're going to be seeing another round of that happening at the beginning of April for households on the SED program. But we also know that in the course of the last year, there was a province-wide audit that was going over many case files looking for ways that they could cut back on people's benefits. And so, yeah, it's not just the kind of big macro picture, it's on a case-by-case basis. We're seeing more and more people falling further and further behind, having benefits that they thought they could count on stripped away.
You said that this is not working, that the province's plans are not working. What would you want to see the province do to reverse course to address this kind of economy?
Well, the first thing, in terms of big picture, we always say that we need to look at these issues from a human rights perspective, which means that commitments that we've made under international law suggest that we need to make sure that everybody has an adequate income, that we have adequate income security benefits. We need to make sure that we have a living wage. We continue to compete for the lowest minimum wage in the country. We need to have protections for tenants, and that means rent control legislation. It also means an expansion and best use of our vacant social housing so that we can house more people who need more affordable housing. And childcare is another issue. We continue to have the lowest childcare coverage in the country. And while it's good that we've signed on or renewed the joint federal-provincial agreement, the reality is that we're largely a childcare desert, and we spend less on childcare as a provincial portion than any province in the country. So this really is, in terms of children in particularly, and I cited the high child poverty rate. One of the things that we know with the April 1st changes is there's going to be a continuation of that with benefits that have been identified for children and parents are going to be cut in said households. So for instance, maternity coverage is being cut. We're going to see a cut to school supplies for children, the visitation allowance. So there's a range of costs that are going to, or a range of benefits that are going to be stripped back further from children at a time that we have the highest child poverty rate in the country.
All right, Peter, thank you very much for talking with us.
Thank you, Alex.
Thank you. That was Peter Gilmer with the Regina Anti-Poverty Ministry, obviously very frustrated with the social services approach.
Parents and students calling on the government for proper investment in public education. And over the last year, we've heard the Premier and the Minister talk about how education is a priority, and this budget announcement goes completely opposite direction of that. It doesn't address any of the complexity challenges that we're experiencing in schools, and it, in fact, takes a step back on per-student funding. This budget, with a conservative inflation rate, and a conservative estimate for enrollment growth from the government, where our calculations show that this is actually a decrease of $33 in per-student funding when we adjust for inflation and enrollment.
So you said you felt like there was some momentum, positive momentum in the last year. Going into negotiations now, your contract's going to be up, even though it was agreed to not long ago in people's memories. What are your thoughts about the message the government might be sending to teachers?
Well, it's concerning because in all of the conversations that I've had with the minister, there's been commitment to have collaborative conversations, and we are committed to approaching negotiations in good faith and really hoping to get an agreement at the table as quickly as possible so that students and teachers can be supported in their classrooms. This budget shows that without that political force and political pressure, this government is just going to continue to ignore students and the challenges challenges that they experience within classrooms. So I know teachers are committed to supporting their students, and we hope that parents are right there with us because it's going to take a large group effort to continue to put that political pressure on government to ensure that our classrooms are protected. This budget does not protect our classrooms.
Is there not enough money to hire more teachers? Is it not to address classroom complexity? Is it kind of all across the board?
That's a good question. So again, the minister through this announcement, or the budget announcement, has again improved their student support classrooms, so there should be some additional teachers that are able to move into those roles. But when we know that inflation is going to be about 2.5%, if not higher, and the government has predicted an enrollment increase of 700 students, when you adjust for that specialized support classroom being about 1% increase to funding that's needed, you reduce that off of the 2.6% increase that they've provided through the budget, we're left with 1.6%, which is less than inflation. And you and I and everyone in Saskatchewan is impacted by inflation, and we know the challenges that come with that. Schools and school divisions are not immune to it. So we predict that school divisions are going to have difficult decisions ahead of them to determine how they can allocate resources, and we likely predict that there are going to be cuts to services that are provided in school divisions.
Samantha, thank you for your time.
Thank you.
That's Samantha Beacott, president of the Saskatchewan Teachers Federation. We'll hand it over to Alexander Quon. Alex.
Hey, Adam. Thank you very much. Yeah, I'm here with Mayor Cynthia Block of City of Saskatoon. Mayor, what are your thoughts on this budget?
Well, I know that this has been a very tough budget for the province, and we are grateful that municipal revenue sharing has not been touched. And I think that we've really come to expect that as municipalities across the province. I think that in difficult times, we all want to make sure that we can at least plan. And this allows us to keep planning.
Some of the challenges for municipalities are obviously getting kind of the money to be able to build projects that you want to build. That wasn't included in this budget, but I guess what are the challenges for cities that you're seeing right now?
I think in this budget you can only sort of provide to the province what you know so far, and without another order of government being involved, it's pretty hard to know how to do massive infrastructure projects. We are very much waiting in great anticipation for the federal budget this fall, because we need a long-term national infrastructure program that cities can work with their provinces to deliver big projects. I think that is something that I'm expecting this fall, and something that I think the province is willing to work with cities to make sure that we have the ability to do those projects.
And you're talking about a replacement for the ISIP program, correct?
Right, and that we're looking for an opportunity for the federal government to look at this. Saskatoon is not Toronto, and Saskatoon is also not Weyburn. How can we make sure that we are delivering programs to municipalities that fit the needs that they have? For some cities, maybe it's major water infrastructure. It's going to be different depending on which city you're in.
When you want the flexibility, I guess, you're kind of waiting for the federal budget. What are the discussions that you're having with councillors, with the provincial government, in terms of maybe getting ready for whatever comes in the federal budget?
Well, last fall there was a delegation of municipal leaders from Saskatchewan and the provincial government, and we went to Ottawa to lobby the federal government for a lot of opportunities around infrastructure. I think they were listening. I also had the opportunity to do the same at the Big City Mayor's Caucus in February, and I think this is being well received, to understand that we need that long-term planning, and we need to let municipalities work with their governments to be able to deliver the programs that they need. And right now we're working really closely with the provincial government on some really important infrastructure for our city.
You mentioned the Big City Mayor's Caucus, and what are you hearing from other mayors across the country? Are they having some of the same issues that you're facing in terms of getting the money for infrastructure projects?
I mean, there's probably two pieces to that. I mean, it's infrastructure, but also a funding formula for municipalities that is created in the horse and buggy age, and it is an unsustainable financial model that is increasingly a regressive tax system when we generally only have property tax to fund the things that cities do. We need a new deal with Ottawa. We need a whole new fiscal framework to ensure that we can deliver for the residents what they need and how we know we must build our city and make sure that that strong infrastructure is there, but in a way that is more fair, in ways that are more affordable, particularly for people that are struggling.
You mentioned obviously the kind of the taxation powers that this city has were kind of laid out in a system that was created very, very long ago. I guess what powers would you want to see? What kind of discussions are you having with the provincial government?
I don't think that being prescriptive is really the goal. I think that allowing municipalities across the country to have a share of income tax makes sense. I've mentioned, very grateful for municipal revenue sharing in our province, but how do we make sure that that revenue keeps up with inflation and growth, particularly in a city like Saskatoon that is among the fastest growing cities in all of Canada, and we're having a hard time keeping up.
Awesome. Mayor, thank you very much.
Thank you.
Thank you. Adam, that was Mayor Cynthia Block from the city of Saskatoon. I'll throw it back to you.
We'll head down the highway from Saskatoon to Regina. We had Mayor Cynthia Block. Now we have Regina's Mayor Chad Baczynski with me. And Mayor, what's your overall reaction to this year's budget and how it affects city taxpayers here in Regina?
I think first reaction is obviously the biggest one for me is the municipal revenue sharing. I mean, that's a big, it's a bit of a sigh of relief, I would say, given that there's an $800 million deficit, to know that we're not only maintaining but increasing the municipal revenue sharing. You know, for Regina, and I know, you know, most municipalities, we're struggling with the increased costs of construction. We have many projects to complete, many infrastructure projects to catch up on, and so for me, that was the initial reaction. That I was thankful that particular program that gives the municipalities the latitude to invest in our communities where we know is needed, with no strings attached. So that was the first reaction for sure.
I just heard from Cynthia Block there. I know you couldn't hear her, but you guys would be familiar with their position on what you'd like to see the cities be able to maybe lobby the provincial government, for lack of a better term, on changes to taxation. What are you asking for as the mayor of Regina?
Yeah, we're asking to open up and talk about what those models could look like, and it's not meant to be prescriptive, but it's meant to say what is a good mix and model of different, whether it's taxation, whether it's revenue sources, things like, do we need to charge PST on municipal construction, if it's more of a cyclical route. That being said, all those dollars go into, come from one place at the end of the day. So really it's trying to open the conversation, what those tools could be. And it's similar to what we do at a municipal level. We make decisions every day on where we want the user base to pay and where we want the overall tax base to pay. And so it's a similar kind of idea to bring the province and even the federal government into the fold to say, how do we find that right balance to make sure that when a user pays for something, it makes sense, and where we agree as a society that the overall tax base should take on that as a whole.
What did you like to see from the government? Maybe it was in the budget, maybe there wasn't enough on things that help people that are dealing with mental health and addictions issues.
I think first and foremost, last year I was able to work with Minister Jensen on getting some more funding for warming spaces, and that's a good step. But that's not the solution. That is definitely an emergency response, a reactive nature to frankly our climate. What I would like to see and continue the dialogue on is more supportive housing, more transitional supports, wraparound supports, mental health and services supports, all those things that we know that people need on a longer term basis. It's not a 3 or 4 day fix, so to speak, to get to a better place. These are long-term commitments that you need to get people to a better place, and follow them through that journey to get them into stable housing over time. So that's something that I'm going to definitely be working on with the government to see how do we navigate our way to a more sustainable solution for people that are trying to work their way through that housing continuum.
How's the relationship been between yourself and the provincial government? You mentioned Minister Jensen and the other ministers. Have you found them to be receptive to the request from the city?
Myself, I have found them to be receptive to sitting down and having a conversation. We may not agree on everything, but I have to give credit where credit's due. Their doors have been open, and whether it's asking for a meeting or otherwise, they've been quite receptive to be able to sit down and actually have a conversation. And from my perspective, I want to come with data and I want to come with solutions. So my hope is that it's my approach that is not coming from a place of just asking for, the sky is the limit. It's coming with practical solutions and advising what, from a municipality, what benefits that the province could see in investing in certain programs and services.
Mayor, thank you.
Hey, thanks for having me.
That's Mayor Chad Bashinsky. Regina's mayor joining us live from the Rotunda, the Saskatchewan Legislature. Then I hand it over to Alexander Quon. Alex.
Yeah, thank you, Adam. We're going to be joining a scrum with the Health Minister, Jeremy Cockerill, in progress now.
Those have been waiting for longer than 6 months. How does this budget address the issue of surgery wait times?
Well, in several ways. I mean, there's obviously additional funding for surgical pathways. And the surgical pathways, I think, is a really important piece in terms of ensuring that, again, we're building these teams of medical professionals that are evaluating folks waiting for a surgery. Maybe it's a day surgery they need rather than a much more significant surgery. Maybe they're a non-surgical patient and can be treated in other ways. And so that, I think those surgical pathways, specifically around back surgeries and spine surgeries, I believe will have significant improvements on wait times. I would say, though, what I mentioned earlier on recruitment and the targeting of professionals right across the province and training more professionals right here in the province, that has a really positive impact on how many surgeries we can do. Again, we just re-signed in the fall our contract with our private surgical provider, again, the publicly funded, privately delivered surgical provider. We've added to that contract so they can do more types of surgeries. We're really excited about the volume that we'll see out of that contract, in addition to the increase that we've seen in our public system as well. It's important to note, we talk about the acute care bed expansions in Saskatoon, so specifically at Saskatoon City Hospital, Royal University Hospital, and as well at St. Paul's. As we have acute care bed space, that means, again, that patients are flowing through those facilities better and that we have more room for people who are post-surgical, and that means we can get more surgeries done.
Minister, can I just get your thoughts? What are the highlights for you in this budget for the health portfolio?
Yeah, obviously last week we released the Patients First plan. I think a really exciting plan with 50 next steps, focused on solutions, focused on patients, making sure that all patients in this province can get the right care at the right time, as close to home as possible. So obviously, there's about $104 million targeted specifically at the Patients First plan. $25 million roughly is for what was the new items that were announced last week in the Patients First plan. So that's particularly exciting. But when I look at some of the other pieces that weren't announced last week and were saved for today, really exciting increase to emergency medical services. When folks call an ambulance, they want them to be there as soon as possible. And so some of the enhancements we've made there around wage parity, around additional stabilization positions in communities that have had a challenge recruiting to those EMS positions. We've worked very closely with the paramedic chiefs of Saskatchewan over the last several months to understand what are the specific pressures and what are the solutions needed. This budget funds those. Also, I'd say we talked earlier here about the MS clinic coming to Regina. This is massive in terms of ensuring that people have access to the right care as close to home as possible. If you're a patient in Assiniboia living with MS, you won't need to drive to Saskatoon anymore to get specialized care from a dedicated MS team. That'll be available in Regina. I think that's really exciting.
Minister, you also announced some more money towards security and security expansion at hospitals in Regina, Saskatoon, and Prince Albert. Why is that necessary? Why is that money in this budget?
Yeah, so obviously the security enhancements made at 8 facilities over the last several months in terms of adding metal detectors, have already had an impact. And I can speak for my own community. I was supporting a family member in my own Battleford Union Hospital a few weeks ago. Just seeing the work of the security guards there take weapons and prevent weapons from entering a hospital facility so that patients can focus on receiving care, absolutely important. The funding that's announced today, it's collaboration between us and the Ministry of Community Safety, and that'll be adding additional bodies, additional presence, and metal detectors are great, but we also need to have on-the-ground presence. And I look forward to those coming online in those 3 cities because, at the end of the day, hospitals need to absolutely be a place that are free of weapons, that are free of violence, where patients can just focus on receiving care, and where our healthcare workers, more importantly, don't have to worry about feeling threatened, and they can focus on providing that patient-focused care.
We also spoke with some unions, QP, Sun, they've expressed concerns. Specifically, QP says that they don't feel like their members are frustrated with not having a contract for 4 years. I'm just wondering, can you give us an update on the state of bargaining around some of these contracts that have been prolonged?
Yeah, no, and you know what? I mean, QP would like to get a deal done. I'd like to get a deal done too, right? And I want our healthcare workers to be able to not have to worry about contract negotiations and be able to focus on patients, right? And so all of our tables are open right now. We have, I'd say, advanced discussions at several of them. There is money in this budget for the settlement of some contracts. Well, obviously, we can't book the full amount until we know, how those negotiations end. We're not at even a financial stage of bargaining yet with most of our tables. I had a good chat with QP President Bashir Jallow here. We want the same thing. We want a good deal for their members, a deal that will provide stability for our healthcare workforce. There's some challenges around, I'd say, getting to a common bargaining table with all three provider unions. There's some things in this province in terms of artificial boundaries that exist from old health regions where we can't have people, you can't have a healthcare worker in one community drive 15 minutes down the road to serve a patient in another community. I don't think that's a patient's first system. So obviously we want to get to a fair deal that will provide really good compensation for all of our healthcare workers, but we also have to be focused on reducing boundaries for patients.
There was also a bill I think I saw in the budget around expanding the scope and powers of the College of Physicians and Surgeons. What was the goal with that? Why was that in there?
Yeah, the Medical Profession Act, obviously it hasn't been tabled on the floor of the legislature, but I think it's also, I don't want to speak too much about the contents of the bill before it's tabled, but obviously looking at how we can enhance the ability of the CPSS to do what they need to do.
In terms of recruitment, I know that the Health Human Resources Plan, you've touted it as something that is game-changing for Saskatchewan.
100%.
How has that gone? What do you think, what are the next steps in that?
Yeah, good question. Obviously, we have the rural and remote recruitment incentive. I think been highly successful. Over 500 full-time positions filled. Several other incentives focused on specific residency in specific specialties for physicians. And as well in this budget is the expansion of the Rural Physician Incentive Program. Typically, that's been a $200,000 incentive over 5 years for physicians to set up practice in rural communities. That's now being expanded to regional communities like North Battleford, Lloydminster, Swift Current, Yorkton. That is going to have a very positive impact. So, and it's all about, I think when we talk about health, human resources, and the recruitment side, it's about really matching what we have on the incentive side with training opportunities, and then that external recruitment piece I talked about earlier. I think we have some great incentive packages in place. This is a significant budget in terms of adding training seats. We talk about a 45% increase in nurse practitioner training seats across the province, a nearly 20% increase to the medical seats in this province. I don't think there's a provincial budget across the country this year that is going to see that significant of an investment in training. And why that's important for recruitment in Saskatchewan is as we train more Saskatchewan kids, that is who we have the best chance of retaining right here in this province and serving Saskatchewan patients for decades to come.
In terms of getting those seats available, making sure that people fill them, do you see that as a problem, having to fill those new seats?
You know what? It's something we watch closely in terms of the utilization of all of our training programs. There are some programs where we'd like to see better completion rates or more seats being filled. But we've been working closely with the College of Medicine, the College of Nursing, Sask Poly. I have full confidence that we'll be able to stand up these training seats and that they're going to be really attractive. Like, look at the physician assistant program that we just started last September. 20 seats and over 800 applicants. There's massive interest. Despite what the NDP say, there's massive interest for Saskatchewan kids to get into a career in healthcare. We just have to provide them with the training opportunities and the right incentives. This budget is a good step forward in that.
I know the NDP during question period, just before the budget was tabled, they raised an issue around how many American doctors had been hired by the provincial government. I think the answer was 3. I know you responded, but can I get your response to their concerns?
Yeah, obviously, let's go back a year after the election of Donald Trump. There were some rumblings in the healthcare community in the United States that people wanted to come to Canada. So I think every province took an opportunity to kind of take advantage of that and do additional recruitment campaigns. Saskatchewan was no different. We targeted some specific states and communities, have had conversations with several hundred, American physicians. We are in kind of down the road on recruitment with about 15 of them, 3 signed offers. And this number in BC that's touted, I would caution the use of that number because, and again, I'm from British Columbia originally. I would question how many of those 400 healthcare workers are actually living in British Columbia. When the Saskatchewan Healthcare Recruitment Agency works to recruit people, We want people to be settling here, bringing their families to Saskatchewan, setting up a life. We're not looking for locum employees, we're looking for long-term healthcare workers in the province of Saskatchewan.
I guess what's the challenge in recruiting from the United States? Is there a specific challenge that the health system is facing when recruiting?
Well, so when it comes to compensation, we're more on par with the United States from a physician perspective than we would be with other jurisdictions. So, for example, that's one reason why we've seen, I think, or we will see more additional success by recruiting out of the UK and Ireland, is because there's a bigger compensation gap from those jurisdictions. And I think you have people looking to come to Canada, looking to come to Saskatchewan, and it comes with a significant increase in compensation. That delta in compensation is not quite the same. And also, I mean, the reality is we have a publicly funded healthcare system here in Canada and in Saskatchewan. And so if you're not used to working in that type of a system, that could be an adjustment. So again, we continue to have ongoing conversations. If there's even a sniff of interest from any physician around the world in coming to Saskatchewan, we have the Saskatchewan Healthcare Recruitment Agency, and they're a really strong team chasing down those leads, understanding what needs to be done, and figuring out how we get them here.
Awesome. Thank you very much, Minister. Awesome. That was Minister Jeremy Cockrell, the Health Minister. I will pass it back to you, Adam. I think you have a guest as well.
Yes, thanks, Alex. I'm here with the Education Minister, Everett Hindley. You're watching CBC Saskatchewan's live coverage of the 2026-27 budget. Minister, what's your message to the education sector, K-12, with what the government's done with this budget this year?
Yeah, we wanted to make sure that we continue to make significant investments into the education sector. And I think we're building on some previous record investments into education. This year's investment into operating is $2.5 billion. So about a 2.6% increase over last year's budget. Remembering, of course, in the previous two budgets, it was 8.8 and 8.4%. So the last 3 years, it's been about a 20% increase to school operating. There's some important investments into capital across the province, making sure that not only are we announcing a few new schools to be as part of this year's budget, but continuing the work on those that are, the 20 or so odd schools that are underway right now, various stages of construction, and continuing to support teachers, EAs in the classroom, and doing everything we can for our students.
Talk to a couple of the stakeholders you'll be familiar with. I'll start with the School Boards Association, who said that they're happy about the operating for the capital of the new schools that are being announced. Of course, they have communities that want more schools. Yeah. But Sean Davidson said that in many communities, including his own, there's schools that are quite a few years old, yeah, and the population isn't growing there, but they need the school to still be operating and working, and that they need money for fixes these schools, renovations of these schools. Yeah. And he said that's fallen short. Yeah. What's your reaction to that?
Well, I would point to the record investments we've made into capital over the past number of years over the term and time of our government. 74 new schools across the province, 54 of which are open today. The other 20 in various stages of whether construction or design and planning. That's just on the major side. We know that there's also minor capital projects, major renovation projects. One of those announced today in the community of Esterhazy, a major renovation project there for that particular high school. Some investments in other parts of Saskatchewan. We'd point as well to the preventative maintenance and renewal budget, which is, we increased that last year to $65 million, and that's maintained at $65 million in the new budget year. And school divisions can use that. We recognize that we're trying to address challenges right across this province, whether they're in the capital city, here in Regina, or in rural and remote communities from corner to corner to corner to corner across this province. And we as a government are taking that very seriously and want to make sure that we're making those investments as much as we can with the dollars we have in a sustainable fashion.
What's your concern about fuel costs rising and just the cost in general, because these school divisions, and Sean pointed out, they're sometimes traveling great distances, school bus costs, the cost to heat the building, those sorts of things, those are going up. What do you make of those pressures that are facing these school divisions?
Well, absolutely, and those are real pressures. They impact all of us, whether they're schools or whether they're homeowners and businesses. So those are a real cost, and we understand that. We know that there's pressures when it comes to putting school buses on the road, and we've been working to invest more into transportation. One of the things that was, I know, a significant impact for school divisions was the amount they were paying on an annual basis on the carbon tax. And not to relitigate that, but that was one of the reasons why it was very important to get the carbon tax off, because that was impacting our school divisions. So, but aside from that, these are real costs, and so we're doing everything we can, again, within the Ministry of Education, to be able to continue to provide that support and help do that work with our education partners.
talked with the president of the STF, Samantha Beacon, not long ago. She said she thought there was some, positive momentum, let's say, over the last couple of years with the ministry and with spending and what the teachers were pushing for. She says she feels just let down by the budget this year, that it's not keeping up with inflationary costs, that schools are going to have to go without, school divisions are going to have to make tough decisions. What do you say to that?
Well, that's disappointing because we have made some significant strides in education. I pointed to the 8.8 and 8.4% increases to the education budget in the past 2 years. The fact that it is a 2.6% increase in this year's budget, it's not going backwards. And we've worked really hard to make sure that that this ministry, I as the minister, have been having collaboration with the STF, with the SSBA, with individual school divisions, whether it's school boards or administrators, and most importantly with families and with students, to address the variety of pressures that are out there. Knowing that I would argue that there's probably never enough money at the end of the day to fund absolutely every single ask at the table. So those are part of the difficult decisions as government, to try to make sure that we are making those investments, to continue to support our teachers, support our EAs, and give our Saskatchewan students the best possible chance they can when it comes to getting their education in our schools.
Does that concern you at all with the contract negotiations coming up? It seems like it just happened, but it's going to be coming up very soon.
Well, we absolutely are looking forward to continue to bargain in good faith with our partners. We're very grateful for the work that teachers are doing in this province. We've hired an additional 500-600 more teachers across Saskatchewan. A number of those are the classroom complexity teachers, and we very much value their contributions. So, the bargaining will begin a little bit later this spring. As you said, it seems like we just wrapped up the last CBA, but it's time to begin renegotiating once again, and we're hopeful that that can be resolved.
Minister, thank you.
You bet. Thanks, Adam.
That's Minister of Education Everett Hindley joining us here live from the Rotunda at the Saskatchewan Legislature. We'll throw it over to Alex Quon. Alex.
Adam, thank you very much. I'm with Jason Monteith, the VP with SEIU West. Jason, what's your response to this budget?
Some of the things that we heard sounded good on paper. Certainly when they talked about urgent care centers, long-term care facilities, hospitals, we certainly welcome those. But the reality we're seeing right now is the facilities we don't have enough staff to work those facilities. So in order to build those facilities, we need to really focus on recruitment and retention, in particular retention. We're seeing healthcare workers leaving very quickly. They're leaving due to working conditions, burnout, short staffing, and most importantly, they're not feeling valued. Healthcare workers have gone over 3 years without a collective agreement, and almost 4 years since they've seen a pay increase, and it's just not acceptable. It's tens of thousands of healthcare workers in this province are in that situation.
You mentioned obviously frustration, burnout as a feature of retaining workers. What does the province need to do to address the concerns you have?
Well, I think the first thing they need to do to address the issues of our over 10,000 healthcare workers within SEIU West is have those workers get a fair collective agreement. 3 years that we've been at the bargaining table is completely unacceptable. 4 years since healthcare workers have seen a pay increase is unacceptable. We see the cost of living going up. We see their working conditions are getting tougher and tougher every day, and they don't feel valued at all by this government. So until this government can get serious and get healthcare workers a fair collective agreement, I don't see how we can continue to build facilities and staff those facilities without workers.
What do you think is holding up that fair collective agreement?
I feel like there's not a desire to reach that deal. I feel there's a lot of stalling. Our members are feeling frustrated. We're not prepared to give things up that we've negotiated and bargained. They're taking years, 10, 20, 30 years of bargain gains that we've seen. We're not going to go backwards, and our members deserve a fair collective agreement, and we can't have people wait any longer. It's unacceptable.
Can you maybe explain to people who aren't necessarily aware what that does to morale when they don't have a collective agreement for a few years?
Well, the morale's terrible. As I said, staff are leaving on a regular basis. We're hearing people that have worked in healthcare for 20, 30 years saying they would never tell their family to go into healthcare because they don't feel valued. They're telling people to look at other careers. We want people to go into healthcare. We want to recognize healthcare workers as a good profession that's respected by the government. And I want people to want to have a desire to work in healthcare, and that's our goal. The people of Saskatchewan deserve it. And like I said, the first step in doing that is having this government get us to a fair collective agreement and getting this resolved quickly. As I said, 3 years is far too long.
I guess for your members, not having a collective agreement for 3 years, what does that mean for them? What are they missing out on that they could have if there was agreement in place?
They're having to make choices of what to buy, what not to buy. whether to pay rent, whether to buy medications, not being able to do extracurricular activities with their families, having to pick up extra shifts, having to work 2 or 3 jobs. I had a member just last week that's having to work other jobs at other workplaces, doesn't have time with her family. It's frustrating, again, that people are working all these extra jobs, extra hours, and on top of that, the heavy workload, their bodies are getting burnt out. It's not good for morale. People need to be going into the workplace, providing that high level of care and being treated and respected for the work that they do.
We spoke with the health minister just a little while ago. He highlighted one of the things in this budget was around expanding security, expanding safety in the healthcare workplaces. What are your thoughts on that? You mentioned obviously burnout as an issue. I'm just wondering about safety as an issue for your members.
Safety is a huge issue. We represent members in protective services. We certainly welcome the expansion of protective services, but they need to be good in-house protective services. We don't want to see these going to a private company, going to a for-profit to the highest bidder. We need to have people that are going to do these jobs, make a career of these jobs. We've got security officers that have worked for 30 years who have made this a career. Those are the good in-house jobs that we need, and we need to have these publicly funded, publicly run security departments, not to be sending them out to the highest bidder.
What are your members also, what are you hearing from your members about the state of working conditions? You obviously mentioned burnout. I just trying to get people to paint a picture of what this looks like for your members.
It's at a critical state. People are, like I said, not feeling valued. People are going home, they're feeling broken, and that's why people are leaving healthcare. It's a hard job, physically, mentally, and when you don't feel valued and appreciated, that's what they're facing every day. And oftentimes I can empathize, and I don't disagree with why people are choosing to go elsewhere with the way that they're being treated.
When you're a union representative and you have members telling you, I'm burnt out, we're not recommending this as a career for anyone else, what does that make you feel?
It makes us feel terrible because we know these are good jobs, and we know the people that do these jobs, they do it because they care. That's why they go into healthcare professions. They're not doing it for the money, they're doing it because they care about the patients and the residents and the clients that they're dealing with. And in return, this government needs to respect that and value that.
Is there anything in the budget that you are happy to see, or is it just your concern is specifically the lack of ability to address healthcare negotiations?
We're concerned about funding in education. We're concerned that we want to see multi-year funding to our CBOs. Again, those are the organizations that get people healthy, so they're not having to access the system. So we want to see multi-year funding there. And again, I haven't had a chance to really go deep into the budget and dive into it, but certainly we want to see increases to education and to community-based organizations as well.
And I guess for people who maybe haven't been in the healthcare system, what is the state of healthcare right now in terms of the view from your members?
It's in crisis. Again, people are leaving faster than they can recruit them. They're not feeling valued. We're in crisis mode, and it's a critical state. And now's the time to invest in frontline healthcare workers.
What is your dream scenario look like?
Dream scenario is for healthcare workers to get a fair collective agreement. And I want it to go back to when people were proud to, want to recommend healthcare as a career. People went to work feeling valued, and they went home and they told their family and their friends that, you should get a job in healthcare. Right now, that's not what's happening. The reality is people are cautioning people about going into healthcare because they're not feeling valued and they're feeling overworked and they're getting burnt out.
Jason, thank you very much.
Thank you very much.
Thank you. That was Jason Monteith, a VP with SEIU West, talking about the frustrations of healthcare workers who have gone years without a contract. Adam, I'll give it back to you.
Thanks, Alex. I'm here with Nicole Wall from Plain Discovery Early Learning Center. And what's your reaction to today's budget?
Honestly, I'm feeling a little disappointed for myself and the other early childhood educators in the province, but mostly for the children. I feel like the children are the future of our province. They're going to be leading us one day, and I don't feel like this budget reflects that right now. They talk a lot about affordable access to quality care for children and families, and right now our families and children don't have that. Saskatchewan is currently sitting in a childcare desert, which means there are more children seeking care than there are spaces available for care, and right now nothing is really being done to resolve that issue. And there are also a lot of centres right now who are beginning to go into deficits on their budgets because of the current funding model, and that is only going to continue to get worse, which will make access to quality, affordable childcare even more difficult. in our province. And circling back to the children, that's who I'm here for. And I'm just, I was hopeful today that we might see a bit of a change in the history of what the government has kind of done to support early learning and childcare. But they just kind of reflected on and said that they had re-signed the $10 a day agreement, and that's kind of all that we were going to get.
And there was that commitment to stick with the federal program. Did it come as a surprise? Is it not surprising to you? Is it just not enough?
I'm going to say just not enough right now. It's not going to sustain childcare the way that I would like to see it sustained and the way that our community would like to see it sustained. If we want to continue to have accessible, quality programs that children and families can count on, that they seek joy in coming to, that are holistic, that have quality educators that know what they're doing and teaching these children, we need to make sure that the budget reflects that. And I think we need a little bit more.
What's missing?
What's missing? Okay, so first of all, the funding model needs to be changed and amended to support legacy centers who are beginning to fall into deficits. Centers are at risk of closing, and that's not expanding spaces, that's decreasing spaces. There also needs to be something put into place for the early childhood educators working in the industry. Currently, there's no provincial wage grid, there's no pension plans, anything like that. So it's not really a career right now at this time, which is unfortunate. Most of us are here because we're passionate about it and we want to help children, not because it's like financially stable and we're going to be, reaping the benefits as senior citizens. But if they want the children in our province to do best and reach their full potential, I think our government needs to sit and think a little bit before we approve the final budget.
Nicole, thanks so much for your time.
Yeah, thank you so much.
That's Nicole Wall with Plain Discovery Early Learning Center. I'm going to bring in Joan Pratchler now. Joan is NDP opposition MLA, and Joan just heard from Nicole there that she's disappointed that it was just the $10 a day commitment and nothing more than that. What's your reaction to what you saw in the budget as it relates to early childhood education?
Well, I was looking for something for childcare in the budget. It wasn't there. Show me your budget and I'll tell you your priorities. And when there's zero new money in there for childcare. Now they will say there's $12 million, but that's exactly the 3% that the federal government gave them to increase. So there's been no new money. And there has been no updates that they've taken care of the 28,000 spaces that they're supposed to have in the next 2 weeks. That's the deadline. There's nothing in there for those legacy centers who've been around a long time and aren't able to raise their fees. Well, fees have gone up from 2021 to now, as we keep hearing. There's nothing in there for wage grid at all. There's nothing in there for recruitment and retention. And children are a priority, period. And you have to treat them like that. And how you do that is put money in the budget so that you can help children succeed and that our care centers are not going to go under. Again, more and more are on the verge of going under. Not okay.
Are you surprised?
No, absolutely not. It took them that long to sign, and then that's all they got for that debacle with the 6-year-olds in April. They know full well what they need to do. The rollout of the whole system has just been one mess after another, and childcare providers and parents are really suffering because of this. Yeah.
Joan, thanks for your time.
Thank you.
That's Joan Pratchler, opposition MLA. We're talking early childhood education funding. I'm going to throw it over to my co-host this afternoon, Alexander Quon. Alex.
Hey, Adam, thank you very much. Yeah, we're just waiting for Terry Jensen to clear up. He's currently having a discussion with some workers. I guess right now what we've been hearing from a lot of people is frustration with the state of the budget, frustration with what they see as not enough services, and really not enough in the budget to support the people that they work with. So we're going to grab him as soon as possible. Let me see if I can actually get a microphone in here.
Deficit from last year, I think it is just going to increase the instability and or injury to workers and or mental health of workers.
I've toured the province, spoken to a number of CBO individuals from CBOs, different executive directors, frontline workers as well. I've listened, I've understood what the issues are, and that's why we're committed to doing this as quickly as we can. But again, we want to make sure it's done right, so that we're not back here having this discussion again down the road, right? We want to make sure that we're getting what we need to do for the CBOs that is going to work not only for the CBOs but for government. It's also going to work for the individuals that those CBOs serve.
So what I hear is that you do feel that CBOs are in crisis, so you are taking steps. Can you explain then why it's a 1% decrease from last year, though? I understand you're taking steps, but if we are in crisis, how can the decrease?
Well, and I think based on what you heard today in terms of a budget where we have a deficit, we are protecting Saskatchewan people by maintaining the services that we're delivering and expanding where we can. There is a lot of needs within not only the Ministry of Social Services but government-wide. So a 4.4% increase in social services budget overall, which includes a 2% lift to the CBOs. We're in a position where we're trying to do what we can with the resources that we have available at this point. But again, going back to having that working committee between the ministry, between SARC, between the CBOs, this is work. Again, I want it done as quickly as possible, so that when we turn around to go do this again down the road, we have some structure in place so we can address what I heard as concerns and what you're also obviously hearing in terms of CBO workers and what the challenges are within the CBOs when it comes to things like wages and pressures that are being experienced. So that's what we're going to do. Okay.
And then I just have one more question. Would you consider having a frontline worker from the CBO sector sit in and or have a voice on this committee or that's not what you called it, I apologize, but to have their input from a frontline perspective, not just the employer, because overall the employer does have to look after the business side of it. So the frontline worker would have the voice of the people who you are talking about giving more affordability to.
Sure, and I mean, I think we're always open to having the correspondence come from workers in terms of what they're experiencing. We would probably pass that along to our ministry officials as well as the representatives from the CBOs that are at the table to help inform them and maybe help guide the discussion. But at this point in time, what I will do is say, if workers are more than welcome to, provide that feedback to my ministry, and then we can take it to those discussions. Okay.
Thank you.
Great. Thanks.
Minister, just Alexander Quon with CBC. I guess I just wanted to ask you, in terms of the boost to SED and CIS rates, 2% in each. Why was that decided? Do you think that's enough?
Sure. So, 2% increase in CIS and SED is reflective of what the projected in the budget, the projected cost of living increase, and we're looking at about a 2% inflation rate. So, as you're aware, deficit budget, a lot of pressures, especially in healthcare, community safety, and some other areas, and within social services, having a 4.4% increase, I think, is good news. It means that we're doing what we are planning to do the upcoming year, and that's we're going to protect the most vulnerable in our society. So a 2% lift in CIS and SED is also augmented by other increases in other areas within those respective programs as well. So Saskatchewan Housing Benefit, 20% increase in the core benefit for individuals that are renting, whether they be CIS or SED clients. 40% increase in the Saskatchewan Housing Benefit for the supportive stream. So those that need wraparound supports and need supportive living, whether that's semi-independent or full supports, 40% increase. And then in the seeking safety stream, we know that when there's individuals that are fleeing interpersonal violence, these are individuals that are in crisis. Quite often times they have children with them as well. That Saskatchewan Housing Benefit for the seeking safety stream, we're doubling that. So it goes beyond just a 2% basic benefit increase. We're augmenting other areas as well to help make things more affordable.
You were just speaking with some workers from CBOs. I'm just wondering why the changes there. What was the decision-making process?
Well, sure. So with the CBOs, it's a 2% government-wide lift to all CBOs. Again, recognizing cost of living increase is pegged at 2% for the upcoming year. So that essentially allows them to maintain the services we have. When we're facing a deficit budget like this, protecting what we have is critical. And that's why there's that increase in there, because anything less, they would have a hard time keeping up. Again, we're working with CBOs to provide additional services that where possible, to protect the most vulnerable in our society. We've heard over and over from people that I've had discussions with, whether they be individuals themselves, could be families, could be youth in transition. This is a very important area, and this is why that work is going to continue this year on the CBO side.
You've highlighted some of the challenges in this budget. I guess in terms of social services, was there an especially tough challenge here in terms of getting what is necessary to help, as you said, the most vulnerable people in the society?
Sure, and I think when you look at the budget, a 4.4% increase, it's going to allow us to continue to build group homes all around the province. We have 10 group homes in planning and either open or in planning and construction stage right now. We also have a complex needs medical group home planned for Saskatoon. So this budget provides funding so the design work can begin on that. So that's also going to help the most vulnerable in our communities. And I go back to our housing benefits. I go back to the simplification of the SED program to really consolidate a lot of areas. In terms of reporting for clients, there's less reporting, which frees up their time. It also frees up ministry staff time, so they can actually spend more time with the client, helping them achieve their goals. So we're doing a number of things that outside of a 2% increase to base benefits for SIS and SED, 2% increase government-wide for CBOs, but we're also working in so many other areas to improve the quality of life for individuals right across this province that are either in a vulnerable state or individuals that have intellectual or physical disabilities.
I wanted to ask, in terms of addressing homelessness, that's another key issue in this budget. The funding to expand that is increased in this budget. Can you maybe give us a few more details?
For sure. So in 2023, we had the original provincial approach to homelessness, which was a $40.2 million 2-year program that really built the foundation for the services that you see being offered today, whether that be here in Regina, it could be in Saskatoon, Prince Albert, or other centres around the province. What we did in November is we announced a $20 million over 3 years addition to that foundation that is going to be help provide funding to construct a new shelter in Saskatoon, a new shelter in Prince Albert, as well as be there so that when there are emerging needs that are identified by, whether it be our municipal partners or it could be our Indigenous partners or community-based organizations or even ministry staff, that we have resources available to address those needs as they come up. And it's I'm really proud of our team at the ministry, and I'm really proud of our Indigenous partners in Saskatoon, in Prince Albert with PAGC, STC in Saskatoon, RITSIS here in Regina, and a number of our CBO partners, whether that be the Mustard Seed, could be Salvation Army. There's a number of them that we fund to help with the operations of shelters, and it goes beyond the shelters. It goes to outreach teams, and we're expanding those in the two cities of Regina and Saskatoon, so those outreach teams can meet individuals where they are. They might be on the street, they might be in the park, they might be they might be couch surfing, but they need help. And our outreach teams are able to build those relationships and be able to help navigate them to the service that is most appropriate for what they need at that time.
How do you measure success for social services? I know that homelessness has been an increasing problem. Providing SIS and SED benefits is a thing that is continuing. I guess, how do you measure success as social services minister? How do you tell when you're doing your job and successfully doing that job?
Sure. I measure success by the feedback I receive from community-based organizations, from our municipal partners, from our Indigenous partners. When I go and I tour a shelter and I speak to an individual that is in the shelter, and they tell me about their experience of how they were brought in, they were asked numerous questions. When you're asking questions, those individuals know that somebody cares, right? They're not just taking them in saying, sit down, people care. So when I go into a shelter or I talk to a partner and I hear the success stories that we have, that I know that we're doing the right thing. And we want to be able to continue to do that and expand on it. It's what individuals right across the province are telling us they want to happen.
Thank you very much, Minister.
Thanks, Alan.
That was Minister Terry Jensen, Minister of Social Services. Adam, throw it back to you.
Thanks so much. Alex, with Murray Mandrick and Jim Farney. You guys, we'll squeeze you in here. We'll squeeze you in here. We're all friends. We want to get your thoughts. You've been walking around, milling around, talking to folks. Jim, let's start with you. What's your takeaway after talking to some people, having some more time to digest the budget?
I mean, it's understated, right? I mean, for a big deficit, which is a big decision, lots of little things sprinkled here and there, people are kind of, I think, understated. It's pretty muted in the here today compared to what this might have been, yeah.
And when we think about, last year at this time, $12 million surplus, people are kind of scratching their heads a bit. Are they going to be able to pull this off? It turns out they didn't. What are we thinking about in the next couple of months here as we have so much uncertainty with tariffs, with this conflict in the Middle East?
I mean, it's an exact parallel, right? Because last year was like basically 2 weeks after the Trump tariffs came in, all sorts of wild numbers about what that would mean. The biggest single thing that hurt us in the past year was wildfires, right? So we're just in one of these times where there's going to be a bunch of unexpected stuff, and the numbers will not be perfectly accurate for this time next year either. We need to get used to that.
And Murray, that was something I know was brought up with the finance minister. Wildfires, last year was brought up, a contingency fund, we have talked about it. What are your thoughts on that not being present really in this budget again?
People are less uneasy from what I'm hearing right now than either I heard from the finance minister or the premier, who offered maybe a bit of a warning that things are tough, and they touched on wildfires, which they didn't last year. I guess this is a lesson, or maybe lessons learned from last year, is don't try to oversell it, because it's probably easier to undersell it. And I think they did that a little bit more this year. I'm not sensing that people are maybe as angry as they should be, because there's not a huge lift for a lot of stakeholders today, and you're hearing a little bit of grumbling, but then it's, oh well, I guess they're talking about an $812 million or $19 million deficit, so how angry can we possibly be if they're going to be honest about that? Well, you're talking about that along with last year's, and you're talking about a government that's been in for 20 years and has not seemed to find the right structure for its finances right now, and that surely has to register with some people. Now, maybe that will come out during the days, because the rotunda doesn't really matter. I like the place. You get to see a lot of people. I would just be playing checkers in the park otherwise. But honestly, I think it's just sort of the days after when things kind of sink in, and the weeks after. It'll be really critical to keep this budget as close to online as they can, because another year of basically pushing the deficit past $1 billion, that ain't good. And it's not good for us, and it certainly isn't good for the politics of the Sask Party right now, because, as I say, they've been in for 20 years, and you're registering annual $1 billion deficits. That's not a good thing, and that's not a good look for a government, and eventually that catches up to you. If we get a credit rating lowering as possible right across the board in Canada, because everybody's in an equal mess, if we get a lot of other bad things happening, this could go south for them very quickly. But for now, I'm actually a little surprised that they're not taking a bigger hit today than they would maybe after last year. People will decide, okay, well, let's just wait and see. At least they're being honest about how much we're in the hole right now.
Murray, thank you. Jim, thank you.
Thank you, Adam.
That's Murray Mandrick and Jim Farney joining us as analysts today on our budget coverage here from the Rotunda in the Saskatchewan legislature. We're going to take a look at your projected deficit. Once again, as Murray mentioned there, $819 million this year, revenue at $21.4 billion. That's up 1.7 from last year, but here's what else is up. Expenses, 5.7 from last year, 1.2 billion in spending for the government gives you that $800 million projection. And over the next 4 years, including this next budget year, we're going to see deficits projected from the government. So a little bit different than what we've seen in the very recent past, as recent as last year. And we look at 2030, 31, so into the next decade, a surplus projected for the government. We have debt projections here, 43.5 billion. Murray alluded to that as well. And taxpayer supported debt at 26.8 billion, servicing that debt's expense of over $1 billion this year as well. Non-renewable resource assumptions, we'll keep an eye on this. WTI oil and Canadian dollar, two things to really lock in on there, as well as the potash price. Those will affect the government's revenue and expense depending on which way they go. We'll look at the revenue areas. Total revenue, $21.4 billion. Most of that is through taxation and 20% through federal transfers from Ottawa. Top spending areas, of course, health at $8.4 billion, social services, education coming in second and third, agriculture, and then interest payments and debt servicing. And with Alexander Quon, catch our breath now. Alex and I have been chatting. And Alex, any final thoughts on this year's budget?
Yeah, we heard a lot from ministers touting, obviously, that this is a budget made of tough decisions. But I think we've heard from NDP members, critics, saying this doesn't do enough and that it was a series of poor decisions, essentially. The phrase we've heard repeatedly is a bad news budget from the NDP. We've also heard from a number of community organizations who have vested interest in doing this and in some of the results of the budget, and they aren't happy either. It's a deficit budget. It's going to be a number of deficits in the coming years. I don't think anyone's truly happy. Even the Premier, when I spoke with him earlier, said he would have preferred to balance the budget rather than running deficits. So I don't think it's a budget that's going to please many people.
Alex, thank you. Great work today. Alex's work isn't done. He'll be live on our television show tonight with Ethan Williams coming up at 6 o'clock. He'll have the Premier and the finance critic Trent Wotherspoon. Tomorrow on the morning edition, you can hear the finance minister Jim Ryder with me, as well as the finance critic. That's it for our show from the Rotunda of the Saskatchewan Legislature. Thank you for joining.